Hello everyone, my name is David. For those of you who don't know me, I'm currently working with our outpatient clinics at Wake Forest Baptist Health. I work with a lot of the clinic logistics from a day-to-day and scheduling perspective. Wendy reached out to me and asked me if I would put together a video that shows, or rather explains what you need to expect or some of the things you need to know about having a doctor's appointment during this COVID-19 pandemic. As of right now, most office visits have been transferred or converted into either a phone or a video visit. Most organizations in the area are trying to go this route because there's a less chance of exposure for both the healthcare provider and for the patient. So if you do have a concern, if say you're feeling sick, you have a cold, and you call your doctor's office, what they may do is they'll say, okay, we're going to schedule you a video visit, and they'll get you in touch with one of the schedulers who will then give you instructions on how to set it up. What that looks like primarily, like if you're a patient at Wake Forest Baptist Health, you will use MyChart to access this virtual room. You can do that through your desktop computer, or if you're using your phone, they will give you a secondary app to download in order to create a secure room for the visit. If you don't have My Wake Health and you don't want to download it, there is an additional way that they can send you a link to where when the visit is about to start, you'll get a text, and in the text there'll be a link that you open it up on your smartphone, and then you can start the visit there. In addition, if you don't want to do a video visit at all, they can always just do a phone visit. But the provider may come to the conclusion that you need to come in for your appointment rather than doing your visit virtually based on your symptoms or the provider's discretion. So if you do need to go in, some of the things you can expect is they will assess you when you go to walk in the door. They'll take your temperature. They'll ask you about your current symptoms that you're experiencing. They'll ask you if you've been to any of the hot spots that are here local in the United States, or if you've traveled outside the country, or even if you've come in contact with anybody that has a positive diagnosis of the COVID-19. Currently right now at our outpatient clinics, like our doctor's offices, we are not testing for COVID-19. There's a series of steps in order to get tested just because of the limited amount that we have. If you're admitted for suspected COVID-19, that's when they will perform the test within the hospital itself. If you are experiencing these symptoms and you are concerned that you may have contracted the virus, we have some what are called respiratory clinics, or like critical respiratory sites, to where if people are either suspected or are having respiratory symptoms that need to be assessed, then they are routed to one of these locations. There are a few, I believe we have 10 or 12 now, options that you can go to, and the provider would tell you whether you needed to go to their office or that location. There are a lot of changes with healthcare that are happening every day. Just like with everyday life, there's a lot of things that are changing. This is hour by hour some days, but really the end result is trying to best care for our healthcare workers, keep them safe, but also care for us as patients as safely and effectively as we possibly can. As Christians, one of the things that we can be encouraged by is that everything that's happening now has been ordained by Christ, and we can all look forward to the day when he has made all things new and we don't have to deal with COVID-19 anymore. But for the time being, let's do our best to respect our healthcare workers and the advice that they're giving us, because they are looking out for our best interest as well as the interest of all the other patients in the area. Thank you all for your time.